Hi, folks. I want to comment a little bit on the case that we did about the deaths at Memorial Hospital, and I want to do so in a uh, very singular sort of a way. I'm going to put on my expert witness hat. My expert witness hat is a hat normally worn by the Uyghurs, an ethnic minority in China, mainly Muslim. And I had a student who gave me this hat. I love this hat, so I'm going to put it on. So there's been a tremendous amount of discussion, very clever and very thoughtful about what was going on in this case. But it's time to think a little bit about what you would do if you were faced with this data. I got a phone call that morning after that article appeared in the South Bend Tribune from a former student, and she had been one of my executive MBAs. She was also an attorney, and she was on the board of the hospital. And of course, she was very concerned. And the reason she was on the board of the hospital is because she was an attorney and she was an MBA. So she called me and said, "What should I think about this?" And when I saw the numbers in the initial case, I thought to myself, okay, I'm going to take a very dispassionate view of this, and I'm going to say, I've got what appears to be a sample of somewhere in the 30s, maybe the 40s. The paper indicated 30 plus cases. And the proportion, the failure rate, and that's a proportion, was exceedingly high, 4 times higher than the national average. I can tell you right now that if you ask the question, are these people representative of the overall population, they are many, many standard deviations away from the standard in the nation. So clearly there was a problem here. Now, we know that there are a lot of underlying factors that might suggest that, well, it's a question of mix, it's a question of other factors. We really have to think very carefully about it. But ultimately, somebody's got to make a decision about this thing. So we introduced later in the case the blog where the blogger suggests that the sample size was not 30, but the sample size was an order of magnitude higher, maybe 300 or 400. Now, you can't believe everything a blogger says. But if that's true, a sample size of 300 or 400 contains a heck of a lot more information than a sample size of 30. And if you find that to be true, then you can clearly say the probability of sampling and getting this sample with a sample size of 300 is minuscule. It is tiny. Ignoring all the other underlying factors. So from a strictly statistical point of view, and of course there are flaws with that, there are things that are missed, there are things that are ignored, the evidence is very, very strong. You could create a confidence interval about this sample mean, even with 30, and you would not capture the population mean, which was closer to 5%. Additionally, some of the articles that were cited by you in the course of discussing the case, one included comments from Dr. Blackstone, one of the experts from the University of Alabama, Birmingham, I think, that had since gone on to Cleveland Clinic and is also the editor of the most important journal in heart and thoracic surgery. So this is the guy who wrote the book on it, and he suggested that a proportion of 10% is inexcusable under any circumstances, regardless of the mix. He refused to refer to this particular case because I'm sure he signed documents at Memorial Hospital saying you will not discuss this particular case. So from a strictly technical point of view, what we have here is a pretty open and shut case. Now, if I'm hired as an expert witness to prosecute this thing, you know that there will be other expert witnesses on the other side that will bring up all kinds of issues. But clearly, if the blogger is right and there are 300 to 400 in the sample size, the question of mix kinds of goes away, uh, unless this is a very very specialized sort of hospital and uh, sort of system that takes only very very difficult cases. All right, my 2 cents worth. The discussion was excellent. Uh, Ultimately, someone's going to have to make a decision about this thing, and I wanted to provide you with that perspective. Adios.